I think that's a great question, and when we think about emerging, we keep hearing this term "new normal," that we're really not going to go back to exactly the way things were, but we have to have this expectation of some modified normal. So when I think about how successful oncology practices will accomplish that, the word that comes to mind is responsiveness. So clients that we work with in our patient access division, one of the things we're thinking about is how do you turn your patient access team into what I would think of as like air traffic control at an airport, right? So air traffic control knows exactly where the planes are, who's next, who's coming up, who's landing. That's what's going to have to happen in these practices. So you might have a clinic scheduled for a Wednesday in person, and due to, say, an illness by one of those team members or a positive test, you may need to pivot that entire day to telehealth visits, or vice versa. You may need to cherry pick patients that are showing symptoms. And so you're going to have to think of ways to remotely and in advance of the visit, screen that patient. So one of the tools we've developed is a text-based screening tool where patients get texts the day before the visit. It's a responsive experience where they can answer symptom questions, and it's just a way to help identify if they're experiencing symptoms. But that data has to come somewhere, and that's this notion of sort of air traffic control and responsiveness. It's being able to quickly change an in-person visit to telehealth, to reschedule an entire day's patients if you need to, if there's a situation within the practice. I think that type of integration in their clinical workflow and recognition that they're going to have to be ready to pivot to those circumstances, I think ultimately that's what's going to make these cancer practices as effective as possible in this new normal.